Hello, everyone. Today we will learn about the morphology and structure of the kidney. First, let's look at the composition of the urinary system. It consists of the kidneys, ureters, urinary bladder, and urethra. Its main functions are to excrete waste products produced by body metabolism and excess water, maintaining the balance and stability of the body's internal environment. The kidneys produce urine. The ureters transport urine to the bladder. The bladder is the organ that stores urine. The urethra discharges urine out of the body. First, let's learn about the morphology of the kidney. Morphology. The kidney is a solid, parenchymal organ. There is one on each side. It is shaped like a broad bean. It is located against the posterior abdominal wall. Due to the influence of the liver, the right kidney is about 1 to 2 centimeters lower than the left kidney. The kidney has medial and lateral borders, anterior and posterior surfaces, and superior and inferior ends. A depression in the middle of the medial border, which is quadrilateral in shape, is called the renal hilum. It is the gateway for the renal blood vessels, nerves, lymphatic vessels, and renal pelvis to enter and exit. The structures at the renal hilum are enclosed by connective tissue called the renal pedicle. The right renal pedicle is shorter than the left renal pedicle because the inferior vena cava is close to the right kidney. The arrangement of structures within the renal pedicle
from anterior to posterior is renal vein, renal artery, and the end of the renal pelvis. From superior to inferior, the order is renal artery, renal vein, and renal pelvis. The recess that extends from the renal hilum into the renal parenchyma is called the renal sinus. It is occupied by renal blood vessels. Minor renal calyces, major renal calyces, renal pelvis, and fat, etc. The renal hilum is the opening to the renal sinus. The renal sinus is a continuation of the renal hilum. The anterior surface of the kidney bulges anterolaterally. The posterior surface is attached to the posterior abdominal wall. The superior end is broad and thin. The inferior end is narrow and thick. The kidney is 9.9 centimeters long, 8 to 14 centimeters, 5.9 centimeters wide, 5 to 7 centimeters, and 4 centimeters thick, 3 to 5 centimeters. It weighs about 134 to 148 grams. 2. Position and relations. The kidneys are located on either side of the spine, within the retroperitoneal space. They are retroperitoneal organs. The vertebral level of the kidneys. The left kidney extends from the lower border of the 11th thoracic vertebral body to the intervertebral disc between the 2nd and 3rd lumbar vertebrae. The right kidney extends from the upper border of the 12th thoracic vertebral body to the upper border of the 3rd lumbar vertebral body. The superior ends of the two kidneys are closer together, averaging 3.8 centimeters from the midline. The inferior ends are farther apart, averaging 7.2 centimeters from the midline.
The 12th ribs on the left and right sides pass obliquely across the middle of the posterior surface of the left kidney and the upper part of the posterior surface of the right kidney, respectively. The renal hilum is approximately at the level of the 1st lumbar vertebral body, corresponding to the anterior end of the 9th costal cartilage. It is located about 5 centimeters lateral to the midline. Now let's look at the relations of the kidney. The adrenal glands are located above the two kidneys. Although both are enclosed by the renal fascia, they are separated by loose connective tissue. Therefore, the adrenal glands lie outside the renal fibrous capsule. When nephroptosis occurs, the adrenal gland may not descend with the kidney. The anterosuperior part of the left kidney is adjacent to the posterior surface of the gastric fundus. Its middle part contacts the tail of the pancreas and the splenic vessels. Its lower part is related to the jejunum and the left colic flexure. The anterosuperior part of the right kidney is adjacent to the liver. Its lower part contacts the right colic flexure. Its medial border is adjacent to the descending part of the duodenum. The upper 1/3 of the posterior surface of both kidneys is adjacent to the diaphragm. The lower part, from medial to lateral, is related to the psoas major, quadratus lumborum, and transversus abdominis muscles. 3. Surface projection of the renal hilum. On the back, the surface projection point of the renal hilum is at the angle between the lateral border of the erector spinae muscle and the 12th rib. This area is called the renal region. Palpation and percussion at this site can cause pain in patients with kidney disease. 3. Surface projection of the renal hilum. On the back, the surface projection point of the renal hilum is at the angle between the lateral border of the erector spinae muscle and the 12th rib. This area is called the renal region. Palpation and percussion, asterisk corrected from likely typo palpation and striking muscle, at this site can cause pain in patients with kidney disease. 4. Renal capsule. The surface of the renal cortex is covered by a muscular coat composed of smooth muscle, fibers, and connective tissue. It is tightly adherent to the renal parenchyma and cannot be separated. It enters the renal sinus and lines the walls of the sinus, except over the renal papillae. Besides this muscular coat, the renal capsule is usually divided into 3 layers. Namely, from inside out they are the fibrous capsule, adipose capsule, and renal fascia, in order. The fibrous capsule is a tough and dense thin layer of connective tissue membrane that envelopes the surface of the renal parenchyma. It is composed of dense connective tissue and elastic fibers. In case of kidney rupture or partial resection, this membrane needs to be sutured. At the renal hilum, this membrane splits into 2 layers. One layer lies outside the muscular coat, and the other layer covers the structures within the renal sinus. The fibrous capsule is connected to the muscular coat loosely and is easy to strip. If it is difficult to strip, it is a pathological phenomenon. The adipose capsule, also known as the renal bed, is a layer of fat located peripheral to the fibrous capsule and enclosing the kidney. The fat is abundant at the margins of the kidney and extends through the renal hilum into the renal sinus. Clinically, renal capsule block is performed by injecting medication into the renal adipose capsule. The renal fascia is located outside the adipose capsule, enclosing the adrenal glands and the kidneys. Some connective tissue trabeculae sent by it penetrate through the adipose capsule to connect with the fibrous capsule, serving the function of fixing the kidney. The renal fascia located anterior and posterior to the kidney is called the anterior renal fascia and posterior renal fascia, respectively. The 2 layers fuse with each other above the adrenal gland and at the lateral border of the kidney. Below the kidney, they separate from each other and merge with the extraperitoneal tissue and the iliac fascia, respectively. The ureter passes between them. On the medial side of the kidney, the anterior renal fascia covers the surface of the renal vessels and merges with the connective tissue on the surface of the abdominal aorta and inferior vena cava, as well as with the anterior renal fascia of the opposite side. The posterior renal fascia extends medially, passes posterior to the renal vessels and ureter, and merges with the psoas major muscle and its fascia. It also attaches medially to the vertebral fascia. Because the inferior aspect of the renal fascia is completely open when the abdominal wall muscles are weak, perirenal fat is scarce, and the renal fixation structures are weak, nephroptosis or a floating kidney may occur. In cases of pyonephrosis or perinephric inflammation, pus can spread downward along the renal fascia, reaching the iliac fossa or the root of the thigh. 5. Structure of the kidney in section. Observe the coronal section of the kidney. The renal parenchyma can be divided into the superficial renal cortex and the deep renal medulla. The renal cortex is about 1 to 1.5 centimeters thick. In fresh specimens, it is reddish-brown. It is rich in blood vessels. Many tiny red dotted granules can be seen, composed of renal corpuscles and renal tubules. The renal medulla is light red in color, accounting for about 2/3 of the thickness of the renal parenchyma. 15 to 20 cone-shaped, with the base facing the cortex and the apex pointing towards the renal sinus, smooth and dense. Renal pyramids with many darker radial striations can be seen. The striations of the renal pyramids are formed by the parallel arrangement of renal straight tubules and blood vessels. The apices of 2 to 3 renal pyramids merge to form a renal papilla, which protrudes into a minor renal calyx. There are many small holes at the tip of the renal papilla, called papillary foramina. The final urine produced by the kidney flows into the minor renal calyces through these papillary foramina. The cortical tissue extending between the renal pyramids is called the renal column. The minor renal calyces are funnel-shaped. There are 7 to 8 of them. Their edges surround the renal papilla, receiving the excreted urine. Within the renal sinus, 2-3 minor renal calyces combine to form a major renal calyx. Then, 2 to 3 major renal calyces converge to form the renal pelvis. The renal pelvis leaves the renal hilum and curves downward. At approximately the level of the upper border of the second lumbar vertebra, it gradually narrows and becomes continuous with the ureter. The adult renal pelvis has a capacity of about 3 to 10 milliliters. averaging 7.5 milliliters. We have learned about the morphology and structure of the kidney. In the next class, we will study the morphology of the uterus. Thank you.